We'll be discussing arthroscopy of the knee for a torn medial meniscus. The procedure that I did was on a younger individual who had twisted their knee and torn what's referred to as the cartilage or meniscus in the knee. In this particular instance, not only was the meniscus cartilage torn, it also had flipped into the center of the knee, which would block the extension of the knee and is usually quite painful. This surgery is an outpatient surgery. It's a fairly atraumatic surgery. The instruments that are used are in the order of 4 to 5 millimeters in diameter, the largest ones. There's a video camera on the back of the small arthroscopic camera, so I actually watch this procedure on a television screen as I do it. The goal is to take care of the problem with the minimal amount of soft tissue trauma and allow for people to return to function quickly. I remove the attachments at the front and the back that hold the meniscus in place and grab that and remove it from the knee. Once it's removed from the knee, the edge that's left, and we try to leave as much meniscus cartilage as normal as possible, isn't smooth, and with biting and shaving instruments I go ahead and smooth out the remaining rim of meniscus. For someone like this who has an otherwise normal knee, the recovery is fairly quick. I let people walk to their car afterwards, as this gentleman did. Let them begin to walk and move about right away. They get some exercises to do at home, to do on a daily basis. They usually have the individual wait for several days before showering just so the incisions heal. This particular person I saw back in the office yesterday, he was able to walk around well. He said his knee was a little bit sore, but not too bad, not really swelling. So he was doing most everyday activities. He hadn't returned to work because his job requires a lot of kneeling and squatting, and he wasn't quite ready to do that. Oftentimes there's no physical therapy required as long as you do the exercises, and most of the time recovery to activity is within 4 to 6 weeks.